We'll be going to Senator Francis Heyliger for her 7 minutes, and then we'll come to we have Senator Gittins, Senator Joseph, and then Senator Whitaker. 11 strong today. You were able to bring out Commissioner of Health. So, Senator Heyliger, you recognize for your 7 minutes.
Good afternoon to my colleagues. Good afternoon to the people of the territory. Good afternoon to the testifiers. I wanted to ask some questions first and foremost in regards to dealing with the psychiatrist and lack thereof. Have the department looked into potentially having virtual psychiatrists participate? Because as you know, since COVID has come about, we have been able to utilize video in a way that has been able to help so many. Is this something that you guys have been able to look into, since you're not able to get people to actually physically do the job?
Currently, yes, we do. We also had a psychiatrist that worked with our elder shelter-run population. But as DC Steele has indicated, we do that in the clinic, and we also have contracts with 2 entities within the territory, one in St. Croix, one in St. Thomas, that also does telepsychiatry. DC Steele, anything that I missed?
That's correct, Commissioner.
So it's currently available, Senator.
Okay, thank you. I also wanted to, they touched earlier as it relates to vaccinated and the booster shot. What I would like to know, that since those shots came out initially, it was for the original form of COVID. And as we have shifted over to the Delta version, now the Omicron version, and we're seeing that more people are becoming infected, whether vaccinated or unvaccinated. Is this herd immunity stance still part of the process? Because I'm trying to understand that if we're now at a stage where the narrative has changed, where initially it was as many people get vaccinated as possible, that we could then get herd immunity. But since it's been shifted to now get vaccinated because it assists you from not getting as ill as possible and potentially dying, does herd immunity still is it still an option, part of the equation?
Luckily, this afternoon, we have 2 individuals. I'll ask Dr. Tyhan Caesar, who is our expert in infectious diseases, to speak to it. And Dr. Ellis is also here. Dr. Hunt?
Good afternoon. I'm Tyhan Caesar, Medical Director for the Department of Health, Infectious Disease Specialist. Thank you very much for your question, Senator Heyliger. The answer regarding the herd immunity is going to be very tricky, in that the numbers from an epidemiological standpoint remain consistent, that herd immunity is possible when you have about 70 to 80% at least infected or immunized population within the territory. And we know that that is a significant challenge within our community. But I can also further complicate the question by stating that it's not something that we necessarily are battling locally. This is a global pandemic. Therefore, we will really have to hope that we vaccinate and immunize the entire country or nation or world, I should say, a global. It's a global goal. So if we don't have herd immunity around the entire world, what will happen is we will continue to have variants that are going to emerge.
So herd immunity is still a part of this equation, based on what you're saying. 3 minutes. Okay.
Herd immunity is always a part of an equation for all pandemics.
Thank you. I wanted to touch a little bit on Shelterbrand. I had an opportunity to head up there and really get a chance to see the second facility that has been shuttered for some time now. And in conversations and even listening to our governor, I think you guys spoke about putting out for bid, et cetera. And in really digging deep into that, I think I was told that it's an additional 35 units or individuals could go into the second building. Now, if this could be completed, what do you think the potential time frame between a bidding process and completing this project? Because clearly we need to have these additional services here in the territory.
So right now we're looking, it's hard to forecast because you don't know what you're going to come up with, but we're forecasting March of 2023. DC Malloy, let me know if that was an incorrect, but that is the figure we're looking at.
Okay.
You are correct.
March of 2023. Thank you. As an individual potentially dealing with family members that might have mental issues and speaking to constituents in our territory, so one of the things that they are dealing with is, what is the next step? A lot of times they reach out to government agencies for assistance because they don't know where to go. We listen to a lot of the talk shows, we listen to a lot of the conversations in the public, and people don't know exactly if something is happening to them or their family member, what is the first step that they can do in reaching out to the government? Can you share that with us?
The first step is to contact the Department of Health, Division of Behavioral Health and Alcohol and Drug Dependency.
1 minute.
DCC, do you have numbers right at hand so that we can let the general public know where they need to call?
Yes, the number for the St. Croix Behavioral Health Clinic is 340-718-1311, extension 3631. St. Thomas District is 340-774-9000, extension 2105. And St. John is 340-776-6400, extension 6002.
30 seconds.
The other question I wanted to ask, last night I had the opportunity to attend a town hall meeting down in Hull Bay where our residents really spoke up about their issues. And one of the topics that came up that they expressed, they spoke about the need for health insurance and health care and things that they need surrounding health. And what I want to know from this department, how serious do you believe as it relates to our population and lack of health insurance for as many people as possible impacts the wellness of our population overall?
Time.
And do you see that even in the future that we could have some sort of universal health care for our population, which based on the last census is a little under 90,000?
That's interesting because we were having a discussion just last evening how we can actually utilize that. We're not saying that we're going to go into universal health care because that's a national conversation, but looking at how we can utilize the universal health care that's surrounding us in terms of our other Caribbean islands and how we can benefit from them, how they can benefit from us. And so looking at services, how we could think exponentially on how we access care, how we bring individuals to our territory to provide the care. Of course, lack of insurance is going to impact health no matter how you look at it. And overall physical health is impacted by behavioral health. Behavioral health impacts physiological health as well. It's a combination of both. Dr. Hunt, would you like to answer that from a medical standpoint? She may have been called off, but I think I've answered the question from a nursing standpoint.
Yes, you have, Commissioner. You answered it very adequately. Thank you.
Well, may I ask my final question?
I thought you just did, but you may proceed. I thought you just did, but go ahead. You may proceed.
No, I didn't. That's why I'm asking,
You
Mr.
may
Chair.
proceed.
Appreciate it. I wanted to speak a little bit or ask a question in regards to the connection between the health department and the court system. I had an experience where one of my properties was robbed and the individual was taken to court and locked up for a very short time period and then released. Unfortunately, they were released because they have mental issues. Shortly thereafter, I happened to be out in public and he walks up to my car and asks, can you pay me to wash the windshield? And I'm looking at this individual like, I had no idea you came out. And I got to the point where I was feeling sorry for them when I was the victim, because I couldn't understand how this individual has mental issues, clearly is in need of help, but had to be released because they cannot be catered to in our prison system. Now, how does the health department tie in with the court system in potentially dealing with people that have ailments such as this, where the courts can assist them, but they're still allowed to just be put back out on the streets?
We had that discussion a little earlier, so I'm glad you brought it back up so we could read it for the general public who's just tuning in. But there is a system that DC Steele can speak about. Senator Francis is going to also help with that. But DC Steele, can you please go ahead with the courts and how we can work on that behavioral health court?
Yes. Good afternoon. Well, currently, just to answer a specific situation like you're mentioning, there are individuals who are picked up, found to have behavioral issues, and they're not even referred over to the Department of Health for behavioral services. Then there's others who we get the request for an evaluation. The evaluation is completed and submitted. It can then, the judge determines whether, based on the evaluation, this person needs long-term care, or they feel that this person is not a danger to self or others, and they're then released. There's also individuals at BOC who may have that evaluation done in-house with their psychiatrist there at this site, and we're not involved in that process. But overall, we would like to have a mental health court system. So once that individual is identified with such needs, it's expedited through a process where everyone involved in that court has the knowledge and training as well and understanding. So you have an in-house forensic case manager, you have an in-house psychiatrist ready to do evaluations, you have a team that's focused and able to manage those caseloads specifically of those individuals who have behavioral needs who are caught up in the system.
Thank you so much. Appreciate the additional time, Mr. Chair.
Thank you very much, Senator Heyliger. Senator Heyliger, Francis Heyliger, you're recognized for your 2 minutes.
Thank you so much. Good afternoon once again to my colleagues, the people of this territory, and to the testifiers. Commissioner Encarnacion, I wanted to get some details in regards to quarantine. One of the things that I had discussions about is sometimes when the CDC shares one narrative and then there's a different narrative being told here in the territory, how do you guys decide what will be the final response? And I'll give you a quick example. I had a individual that shared with me that they had COVID and they had contacted the agency to find out, do they have to quarantine for the 10 days? But literally around that time, the CDC had put out some information about cutting it down to possibly 5. And in trying to get responses at the time, they were told they have to find out which narrative is going to be put out. Could you tell us definitively, how is your department handling when one message is coming out nationally and then locally we have to potentially either implement it or stand to what we have decided to do in this territory?
Just to let you know, CDC puts out recommendations and not mandates. And so once they put out recommendations, they allow the jurisdictions to make the final decision. So because of our demographic area, it is important for us to be a little bit more conservative on what our applications are. And that's what we've been doing. And we've been very successful, so we're not messing with success. To let you know, what we do is we make a decision. Dr. Ellis, Dr. Hunt and I sit down. We make a decision as what we need best to do. I have to tell you that I've actually spoken with the director of CDC. She knows that sometimes we counter what they're saying only because of our demographics and our geographical location. And she is actually in agreement with that. And then we get it out using social media, radio announcements, press conferences, all the above.
Okay, thank you. As of right now, are we still on the 10-day quarantine as it relates to COVID? Is that the official stance of the agency still?
Yes, it is. Yes, it is. If you are, and it goes one person at a time, if you are fully vaccinated and have the booster, then exceptions to a 7-day quarantine is made, and only then.
Okay, so there's two depending on what status you are. Okay, Earlier we had spoke a little bit testimony-wise in regards to suicide. What I want to know, what kind of advertisement that is being utilized to really push, whether outside of the hotline, are there other programs that you guys are doing, and how do you market this to the public? And I'm saying this because I had spoken a while back to the police commissioner and had asked about statistics of suicides that they are aware of through the department. And
30 seconds.
I'm very much concerned about the mental health and well-being of the people of our territory. So how do we really push suicide hotlines, other programs to this territory?
So we do a lot of information outreach on social media. We do a lot of radio announcements in regards to suicide and suicide prevention. We have ads within the theater so that when you actually sitting down, we have your attention there. And then we also engage the juveniles or the prefix of the younger generation and how they're reacting to not just COVID, but way before COVID. So there are different venues that we use for suicide prevention. The last couple of years, last year we didn't, but prior to that, we had 2 suicide prevention conferences that were very successful. The first one was in person. The second one, of course, had to be virtual, but we'll continue those venues. And we have experts coming down to actually train, as well as utilizing our experts here within the territory.
Could I just wrap up this? In regards to this, have you guys done any studies to see which avenues of marketing and advertising to the public that you get the best results from? So I could better, and the public could better understand how strongly these marketing tactics are in actually getting the message to the public.
That's something that I can speak with the Bureau of Economic Research about, because we're looking at how we collect the data and what we're doing. And I'm sure we can work with them on how we do a really good research study and how marketing affects preventive health care. So that's an excellent conversation to have. So thank you for that.
Well, I would look forward to having a report on it. Thank you so much. Thank you, Mr. Chair.
You're welcome.
Thank you very much, Senator Francis. I know that there's a point of inquiry by Senator Francis Heyliger, and you're recognized.
Ms. Commissioner Kazigo, I am sitting here a little annoyed, and I'm trying to keep my composure as much as I can, because all I really care about is to really understand how your agency is providing services to the people in this territory that need it. And all I'm hearing is excuses and stories and runarounds and you tossing up, 100, because somehow your agency has not done any assessment as to even know how much social workers you have. And I'm sitting here confused. Ma'am, 1 second.
Point of inquiry, Senator.
The question I would like to know, what exactly does your agency do in regards to assessing your needs overall and coming before this body and in an articulate way expressing it to us so we can assist you, so we could help the very people we represent? That is what I'm trying to understand. Thank you.
So, sir, Chairman, may I?
Yes, please respond.
So I currently have 10 social worker vacancies. And when I say vacancies, I'm very hesitant to say vacancies. 4 are on the social services block grant. So as soon as that grant or budget is approved by an OMB, then those positions will be able to be hired or have a PRF for. I have 2 additional ones. As soon as the internal promotions for the district managers are done, then those positions that they're currently sitting in as social workers will then become vacant. So then that leads us to 6 current vacancies. And then I have an additional 4 that are on a couple of other budgets. So once those are all good to go, all the budgets are approved and everything, we can get an approved PRF for the 10 additional social work positions. And so if you look at the historical data, which was important, all vacancies were cut from the budget, including social work positions on the general fund. So so in order for us to succeed, like you've asked, and assess in each area of interest, then what we've done is we've added additional social work positions on federal budgets to ensure that we can serve the public like we do every day. I understand that
Commissioner Kazi Gomez, I just want to say this quickly.
Yes.
I understand you speak of all these positions, but we literally altered people's titles because you couldn't even find or get them to pass social working tests. So how in heaven's name are we going to even fill these 10 and 6 and all these other things you're speaking of if the ones that are there can't even pass the test to be able to become social workers? Where are you going to find these additional people from to serve the public? That is what I'm trying to understand as well. Thank you.
So the question on the thing originally was, how many social workers do I need? I tell you that I need 10 social workers. Whether they're 10 social workers within the Virgin Islands that are currently here, I don't know until I put it out there. I'm assuming that there may be qualified licensed social workers within the territory that may want to come and work at DHS from another agency, private or nonprofit, or want to relocate from the states and come back home to serve. So until I do that, until I do the recruitment effort and they're posted, I won't know. So right now I have 10 vacancies for social work positions. And as a licensed social worker, just for the record, I have a master's in social work and I am licensed as a social worker. So it's very dear to my heart. So I do understand being short-staffed and overworked in a lot of different areas when it comes to being a social worker in the front lines. So it's been a complicated issue since we've been here. We want to make sure that we're staffed up to serve in each area of interest because it's important, not only for the clients, but also for the support of the employees.
Very well. Thank you, Commissioner. At this time, Senator Vieira,
Senator Francis Heyliger, you're recognized for your 6 minutes.
Good afternoon once again to my colleagues. Good afternoon to the testifiers and most of all the people of this territory. When I was about 16 years old, there was a homeless lady that literally lived up underneath the tree next to my house. And I developed a friendship with her because, periodically we would give her food, check on her. And it came to a point where she needed some major help, and even her own family couldn't help her. She wasn't getting help from the government as she needed. And I went to my mother and I said to her, "Mom, can she come stay with us?" My mother said yes. And at 16 years old, for the next 3 years, that lady lived in my home with me and my family. And she thrived because she got the attention that she needed. She got the help that she needed. She was able to stay on her medication. And when she got to a point that she was so ready to blossom, the government came around and stepped back in and said, well, we could help her out now. She went downhill after that. and that's an experience that I have carried with me for years, for about 30 years. And sitting here today listening to the responses, and I was a little frustrated earlier, and as I sat here and I felt like my chest was closing in, and I was trying to understand what that feeling was as I listened to the responses and the back and forth and who didn't do this and it caused a sense of chaos and confusion for me that really saddened me today. Because I hurt for the people that need your services. And we're here talking mainly about one aspect of them, homelessness. But then I sat here and I started to think about the foster care, the seniors, people that have come to human services, molestation. Everything started to cover my mind. And I'm saying that if this is the chaos we're dealing with, just to speak about homelessness, I am frightened. I am genuinely frightened trying to understand what this agency does when it relates to helping the very humans. Human services, helping humans. And when I listened to Mr. Malik Stradiran talk about his 10,000 helpers organization.
3 minutes.
And something he said to me as a senator sitting here, he said the people that come to us appreciate us working with them than even the government. So why are the very people feeling more safe, secure, getting the help they need from a nonprofit that have a fraction of the millions of dollars that flow through this agency? I have all these questions I could ask, but I genuinely need someone to tell me what is happening with this agency. We have 3 sets of people that I would have been proud to say that as social workers, you are now in leadership positions. You moved up the ranks. You know what happened when you started out and possibly had to deal with the very individuals, maybe from the bottom. And you moved up. But it almost seems like it's such a bureaucratic responses that I don't know if people have forgotten that human connection. When I sit here and I'm worried about the homeless lady that was almost raped the other day, because I get to go when I leave here, and when it's time for me to sleep, I have a nice bed to lay in. I have some place to put my head. But somebody is sleeping in the graveyard inside of an empty tomb because that's the best they can do. And I'm sitting here between tears and frustration because we all want to do better for these people. I didn't run for office to be in any back and forth. We trust that every single person in your agency, when they get up and head to work at 8 o'clock in the morning, they go in there with the best intention, with all their thoughts and abilities focused on making and helping the people that need it the most. Help them. That's all I care about. And for the life of me, Commissioner, I understand that you have a lot to do. I'm not going to sit here and try to tear anything down. But you have to understand, when we're listening to some of the responses, and we looked at this testimony, and I'm actually expecting updates, and I'm seeing a lot of fluff. I'm thinking, how serious does the life of that one person that has to sleep on that park bench actually means? It means a lot to me, and I want it to mean just as much to you and every single person that works in human services. Because even if it's one person that you had to find passed out on a bus stop, eventually died, they have to be your priority and your staff's priority every single day. We have to step away from the friendships. I have noticed one thing with this government. It is who you know, what you know, who's friend of who, and somebody could come in and be the most mediocre employee under the sun. But what we do is we shift them. We move them away. We can't fire this person and make sure they understand that their behavior and their inability to do their job is detrimental to somebody else's life. And because we have this mentality and nobody really bears the consequences, this is the result. That I'm sitting here frustrated and fearful of the people that put me in office. Fearful for the people that didn't even vote for me because they needed me to be their voice to come and ask you to help them. I'm just asking you, sometimes as human beings, we have to reset. We have to go back to the place where we began. We have to understand that, yes, I might be up here now, but this is where I started. And remember that you might be here, but there's somebody still down there that you need to reach out your hand and help pull up. And that's all I'm asking of this agency today. So I'm gonna ask when my colleagues bring you guys back, I am expecting an actual update that I could work with in order to help you to do a better job on behalf of the people of this territory. That's all I need, okay? Thank you.
Thank you
Yes, ma'am.
so much, Senator Francis Heyliger. We have 2 points of